Good afternoon, everybody. Good afternoon, Chair Strauss, Crichton, and members of the Joint Committee on Transportation. Thank you for taking time to hear testimony on this important bill. My name is Alexis Walls. I work with the Massachusetts Public Health Association, and I am pleased to offer testimony in support of House Bill 3272 and Senate Bill 2277, jointly known as the RTA Advancement Bill, as you can see from this sticker here. I also just want to take a moment to thank our lead sponsors, Rep. Natalie Blais and Senator Sue Moran, who's online, who are also members of this committee, and all the legislators who have expressed support for this bill. You will soon be receiving a letter in support of this legislation that's been signed by dozens of your House and Senate colleagues. So some of you might be wondering why the Public Health Association is here advocating for transit equity. And to that, I would say at MPHA, we know that the public's health does not begin or end at the doctor's office or in the emergency room. Rather, health is created in the conditions within which people live, work, and play. As a result, zip codes are a key predictor of health outcomes because they reflect access to building blocks of health like housing, food, and yes, reliable and robust transportation. We know that residents who have reliable means of getting where they need to go can complete day-to-day activities that shape health. MPHA co-convenes the RTA Advocates Coalition, a network of community groups, human service providers, and other allies who advocate for transportation justice in response to the wide gaps in transit access that have persisted for years in RTA communities. The good news is that thanks to the work of this legislature, RTAs are embarking on a new path and have been able to begin expanding service to the base level communities deserve for the first time in years. However, if we are going to secure service gains and ensure agencies have the predictability and coordination needed to build upon these improvements, the legislature must pass the RTA Advancement Bill. I'm excited for you to hear from some of our partners today who are going to help paint the picture of just how broadly this issue impacts our communities. But I just want to say a couple of more words about the bill. If passed, this bill would promote responsible service planning by aligning the RTA funding floor with the level of state contract assistance that was allocated in the fiscal year 24 budget. It would create a dedicated source of revenue for RTAs, increased collaboration between RTAs, community stakeholders, and state policymakers, and it would also stop using profitability as a measure for RTA performance by ending use of the fare box recovery ratio. Transit-dependent people in RTA communities plan their lives around the bus just as a person who drives bases their daily decisions upon the reliability of their car. The legislature is taking big strides this session to strengthen transit statewide, and it's our hope that we can count on this committee to not only report this bill out favorably, which you did last session and we're grateful for, but also to work on behalf of RTA communities to help get the bill over the finish line this session. Thank you again for your time.